Let's bring in ABC News medical contributor Dr. John Brownstein for more on this. Dr. Brownstein, this new UK strain we're now seeing in the U.S. is said to be more contagious, but there have been a lot of different numbers thrown out as to how much more contagious and what that actually means. So what does the data tell us at this point?
Right. So the good news is the data does say that this new variant is not more severe in terms of hospitalizations and deaths. And there's not a big difference in terms of symptoms and outcomes. So those are all good data points. There is preliminary data that shows that it's likely to be 50% more transmissible. So that means that it's just more efficiently entering into the cells. It doesn't necessarily change the dynamics of transmission. We know it's still about direct contact and aerosol, but it will lead to more cases overall. And the concern we have is a more transmissible variant will just lead to more cases, which ultimately means more hospitalizations and deaths. So it's not a more severe variant, but the data shows us that we could lead to a bigger surge that ultimately leads to really very sad milestones that we're sort of going to see in the next couple months, unfortunately.
So do we need to be doing anything differently as a result, wearing a different kind of mask or keeping even more distance from others, that kind of thing?
Right. So it's still the same virus, right? So all the precautions that we've been taking should line up in the same way. It just means that the virus may transmit more efficiently. So we sort of have to just double down on these interventions, mask wearing, social distancing. Maybe we don't need to change anything specifically, but we need to be more vigilant. We need to make sure to be wearing our masks. We need to practice social distancing. We should be staying at home if we don't need to be out and we're not, working, doing anything essential. This is why the next couple months are so critical. We're waiting for this vaccine, which we think will work against this new variant, likely does. So this means now is the time to use the key sort of non-pharmaceutical interventions like mask wearing and social distancing. That's what we have at our disposal today.
And the UK is in a national lockdown in hopes of controlling this new strain, but we're already seeing it in Colorado, California, Florida, and now New York State. So are we heading for a full lockdown in the US?
Yeah, this is a conversation you and I have had many times. That lockdown is such an extreme strategy. And we know that, of course, if you lock down, you can control the pandemic, but at what cost? We're trying to keep our schools open still. We can do more to reduce our contacts, increase testing, reduce dining, indoor dining. And we still don't have basic things. We don't have a national mask mandate. We're waiting for that. We don't have a national testing strategy. We're still waiting for that. So again, there's things we could be doing that we're not before that lockdown comes into play. Remember, we have yet to see the impact of the holidays yet. We're going to see that in the next week or two. At that point, it may be at a point where we just can't do enough in terms of targeted interventions. We may be looking at more widespread lockdowns. Hopefully we don't get to that point, but unfortunately we may be heading in the same direction as the UK.
All right, Dr. John Brownstein, sorry to hear it, but thank you for being here.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.